Welcome to California Focus. I'm Dave Mason, the Southwest editor with the Center Square. I'm here today with Kenneth Schrapp, the Center Square reporter covering California. The state has reportedly spent $9.5 billion, with a B, $9.5 billion on healthcare for legal immigrants. And Kenneth,
this year,
how did we get to this amount? I know a San Diego lawmaker has done some additions on this.
No, it wasn't addition by Carl DeMaio. It was Carl DeMaio asking state officials how much they have spent on illegal immigrant healthcare this year, and the figure they said was $9.5 billion. So that is the state's own admission from the Department of Finance, which is an office under the control of Governor Gavin Newsom.
How did those numbers add up? How did they get to that number? What happened over time to get there?
If you're asking why it costs this much, not how they added up, I assume that it just means that they're enrolling a significant number of people. Remember, California, it is the largest state in the country, but it has a disproportionate share of the nation's illegal immigrants. Some estimates generally have it at about the 2 million mark. Others have it much higher. So the number of people who are qualified to enroll in Medi-Cal has grown significantly. We now have, I believe, 30 or 40% of all of Californians in the program. 38.2% of Californians are currently enrolled in Medi-Cal. In 2012, there were only 20% of Californians enrolled in Medi-Cal. So the program has doubled in terms of percent of Californians covered in just 13 years. We've seen this increase in coverage come from expanding eligibility to anybody based on their income, but ending the exclusion for illegal immigrants that we previously had. We also increased coverage by no longer asset testing individuals in the means testing process. This means that very asset-rich individuals who might have millions of dollars in property, in stocks, in bonds, as long as that isn't income, it won't count towards their income threshold for qualifying for Medi-Cal. This means that a lot of people qualify, but another factor here, though, is that wages in the state have not really kept up with dramatic increases in the cost of living. So many more people now count as impoverished because it is really quite expensive to live in the state.
I understand that there's a plurality of people on the state who are on Medi-Cal now.
Right, yes. We have 38.2% of Californians enrolled in Medi-Cal as of April 2024. And the benefits provided by Medi-Cal are rather exhaustive, but at the same time, the supply of doctors who are accepting Medi-Cal has not kept up with the increase in enrollment. This is because Medi-Cal has very low reimbursement rates, and due to new state mandates, a lot of these reimbursement rates fall below the actual cost of providing care. From what I've heard, doctors want to help serve as many people in Medi-Cal as possible, but the rates that they are paid means that they are often taking a loss for every single Medi-Cal patient they accept. So they usually set quotas internally if they're accepting any Medi-Cal patients at all.
And that low rate of reimbursement has been a historic problem with Medi-Cal and with Medicare. Has been a long-time problem with both programs.
Right. But the issue now is that with enrollment so high, covering 40% of the population, increasing reimbursement could be completely unaffordable for the state.
And I understand, too, that the Governor Gavin Newsom is seeking a bailout for this of $6.4 billion.
Right. That money is just emergency money. I believe that the legislator already appropriated or will soon appropriate in order to keep this program funded so that people don't stop getting their doctor's visits that they might have already scheduled. Another issue that we have is the state's new healthcare minimum wage that is rising up to $25 an hour. This covers everybody who works at the hospital or healthcare system, including gift store workers at the hospitals. The state of California is really a pioneer in the sector-based minimum wage. We just saw the $20 an hour fast food minimum wage significantly reduce the number of fast food jobs. People are switching to automation. A lot of businesses are simply shutting down if they don't have the capital for that.
Gotcha. And I understand that an audit has been requested related to Medi-Cal.
That's right. California Republican legislators have requested an audit for the state, really trying to figure out how much money we are spending on illegal immigrant health care, the impact of illegal immigrant enrollment on care for citizens, because we don't have enough money in the state, because the reimbursement rates are so low, because there's a limited supply of Medi-Cal health care. This really is reducing the amount of supply available to citizens. So they want to know how this is impacting Americans, not just all those who are here. The legislators in the letter did say that about half of the state's near doubling of Medi-Cal spending is from providing health care to illegal immigrants. This is no small amount for a state with a budget of $322 billion proposed this year.
And the big question, of course, is this sustainable? Can we continue to fund the program at this rate? And what was the discussion on that?
Well, today there was an amendment proposed by California Assemblymember Carl DeMaio that would have ended state funding for Medi-Cal for illegal immigrants, and it would have ended funding for the state's high-speed rail program. Of course, that amendment did not succeed, but it does highlight how the state doesn't really seem to want to cut spending on a lot of these programs that have become financially unsustainable.
And of course, this is a story that's going to be around for some time. So that is it for California in Focus. I'm here with Kenneth Trump. I'm Dave Mason. For more news, please go to thecentersquare.com.